Hi, congratulations. So exciting to have a new little one. As you begin your postpartum journey, there are some things I'd like to talk to you about. Postpartum hemorrhage is a term we use to explain excessive bleeding after delivery. Unfortunately, postpartum hemorrhage does happen, even though it's rare. Knowing these symptoms will help you avoid health issues. As I said, postpartum hemorrhage is bleeding that occurs following childbirth. This could happen either within 1 day of delivery, which we call primary PPH, or up to 12 weeks post-delivery, which we call secondary PPH. Depending on the condition of the patient, there are a number of factors that can cause postpartum hemorrhage to happen. Uterine atony, which is most common, is when much bleeding happens because the uterus doesn't contract well after birth. It can happen if this is your first baby or your fifth. Some of the causes for uterine atony are if you're having twins, triplets, or more, if your baby is larger than average size, if you're older than 35, if you have too much amniotic fluid, if you're extremely overweight, or also have retained placental tissue, which is bits of placenta that stay inside the uterus, and the uterus can't contract effectively to push it out. Any kind of birth trauma, tearing of the cervix, vagina, uterus, you can continue to bleed, or any blood clotting issues. Some of the risk factors that put certain women at greater risk for postpartum hemorrhage include a very long, fast labor, having twins or multiples, having a very large baby requiring a C-section, or to use forceps for delivery, high blood pressure, preeclampsia, history of postpartum hemorrhage. Some signs and symptoms to watch for is bleeding more than normal. A little bleeding is normal after you give birth, but you should know when to reach out for help. So after you've given birth, if you have bleeding that's soaking through a pad in less than an hour or not stopping, or passing clots bigger than the size of a golf ball, or being dizzy, weak, or faint, having a fast heartbeat over 100 beats per minute, or if it's hard to breathe, your skin looks pale, feels clammy, or you're confused, these are signs to call a doctor, or in serious cases, 911. Now, keep in mind that while not all postpartum hemorrhages can be prevented, there are some things you can do to reduce your risk. You can empty your bladder frequently after birth. That will help your uterus contract properly. Take any prescribed iron supplements if you have low hemoglobin levels, which you do, so be sure to pick them up at the pharmacy. Remember to rest, avoid lifting heavy objects, let your body have time to heal. Keep all of your postpartum checkups to ensure that you are healing properly. So before we finish, let's review what we talked about with a little test. It's called the teach back method. So can you tell me some signs of when you should call the doctor? Very good. Do you have any questions? Or if you don't now, you can call your OB at any time. Your health is very important to us, and we're here to help you every step of the way. Take care of yourself now.